The first gallbladder attack I had, I ended up in the emergency room because I just didn't know what was wrong. It hurt really bad. At that point, I changed my diet, and the problem seemed to go away. Every once in a long while, I would have an issue. About 3 months before I had the ultrasound, I had a very bad attack. I was worried it might be coming down to actually doing something, and that's when I ended up having to have an ultrasound. So that's when they saw that there was actually a stone.
The most effective treatment for gallbladder disease is to surgically remove the gallbladder. So we went over that in great detail, the surgical option. And nowadays, in the last over 20 years, the major way with which this operation is performed is doing it in a minimally invasive fashion. Laparoscopic approach, and now more recently we use the robotic surgery.
The first time I went and saw Dr. Buzad, the first appointment, we already kind of knew that this was a situation where it was going to have to come out just from talking to the rheumatologist and the images they'd seen. But I was still concerned, I was still worried, and then Dr. Buzad came in and he was very reassuring. He has a great bedside manner.
I explained to her that the robotic approach allows me to do this operation through a single incision placed on the belly button. And from a patient's perspective, that approach is cosmetically better looking, but it's also 1 incision versus 4, which is the standard laparoscopic approach. She came back extremely pleased with the cosmetic result. There was minimal pain at the incision, and she was essentially returned to a very normal level of activity at that point in time.
I am doing great today. There's absolutely nothing different. I have no limitations. I do everything that I've always done. I go to work, I get to walk my dog. I haven't had to change my diet. I can eat whatever I want, and in a city like Austin, that's very important.